Well, it only took a matter of seconds for Evansville's tallest building to come tumbling down, the rubble being cleared away to make room for continued new development in Indiana's third largest city. Certainly a key piece of downtown Evansville's renaissance. It's right around the corner at the Indiana University School of Medicine Stone Family Center for Health Sciences. It's one of the largest gifts in IU School of Medicine history, being used to build a mental health center nearby, focused on children and adolescents. Business of Health reporter Kylie Valletta has more. Kylie.
Thank you, Gary. The $34 million gift from Evansville natives Bill and Mary O'Daniel Stone is being used to reverse a major shortage in psychiatric care for children and adolescents in southwestern Indiana. The national rate of psychiatrists to young patients is about 1 to 9,000, but Indiana falls far below that, with only 1 psychiatrist per 21,000 child and adolescent patients. And joining me now to tell us more about the vision to reverse this trend is Dr. Stephen Becker, the Associate Dean and Director at the IU School of Medicine, Evansville. Dr. Becker, thank you for being on the show today.
It's great to be with you, Kylie.
Well, we talked about the need on a larger scale. Give us a picture of the need a little bit closer to home there in southwestern Indiana. Talk just a little bit in your region about this need for psychiatric care for young people.
So I think we're like most communities in the country in that we're very short on child and adolescent psychiatrists. And, you know, we have 5 practicing child psychiatrists in our region with a medical service area of almost 1 million patients. So this new Stone Center will help us almost triple that number within a couple of years. You know, you mentioned some important statistics. Yes, Indiana is 1 in 21,000. The national average is 1 in 9,000. We're actually much lower than the states surrounding us, Kentucky, Illinois, Ohio, and Michigan. But in reality, we need to get to about 1 in 5,000. So we have a lot of work to do to train enough child psychiatrists to be important team members to take care of our young population.
And speaking of that training, building that pipeline to provide more care in your region is a really big focus of this new Stone Center for Child and Adolescent Psychiatry. Explain how this new center is going to help build in more of those clinicians.
Well, first of all, we have started IU School of Medicine second psychiatry program in southwestern Indiana in Vincennes at Good Samaritan Hospital. That was the first part of our focus on mental health in southwestern Indiana, was to start the residency program. So we'll start graduating general practice psychiatrists in another 1.5 years. So that's exciting for our region. We now will start building fellowship programs on top of that. And we plan within 3 to 4 years to start at least 2 and probably 3 child and adolescent psychiatry fellows a year at the new center in Evansville. So we should be graduating up to 3 new child psychiatrists for the state of Indiana and our region every year. Currently in our state, we only have 1 other program, and that's in Indianapolis at the IU School of Medicine.
And another major goal of the center is to become a nationally recognized research center. And you just announced a new leader to help guide that. So can you talk about that new leader and this new research effort?
Sure. So, you know, many people probably do not realize this, but IU School of Medicine is a national leader in Alzheimer's research. We have built over the past 15 years a very strong neuroscience, basic science component to Alzheimer's research in Indianapolis. We're nationally recognized as one of probably the top 2 research centers in the country. That has put a lot of incredible assets at our fingertips to utilize at the School of Medicine. So our goal here is to build a second world-class research center between Evansville and Indianapolis and utilize the resources we've used for Alzheimer's to study and help improve the lives of patients with bipolar disorder. On that front, we announced yesterday that the new first executive director of the Mary O'Daniel Stone and Bill Stone Center for Child and Adolescent Psychiatry in Evansville will be Dr. Stephen Strakowski. Steve is from Indiana, is a native Hoosier, and is very excited to come back and lead this effort, both in Evansville, Indianapolis, and in reality, I believe Steve coming back to Indiana is going to have an effect on the entire state as we improve mental health services for Hoosiers.
Oh, that's great news. So where the center will be is downtown Evansville, and it's part of this larger project to really transform downtown Evansville. Talk about how this new center will help forward that vision even more downtown.
So the new the new Child and Adolescent Psychiatry Center will be in a new facility across the street from the medical school, in the new Deaconess Downtown Clinic. The IU School of Medicine received funding from the first Regional Cities initiative to help build research space. And that was designed specifically with the idea of child and adolescent psychiatry. So we have about 8,500 square feet that's actually finished and ready to go. We have to purchase some equipment and furniture and start recruiting the faculty for that space. So it's going to be a great addition to this part of downtown Evansville.
And we just have a few seconds left, but I know this project is close to your heart and you're very excited about it. Talk just briefly about your excitement about this project for IU, and really, like you mentioned, it's breathing new life into downtown Evansville too.
Well, it's been great to watch what's happened in Evansville. I actually believe that so much has been done, but in reality, I think there is much more to come. It's going to be a very exciting 5 to 10 years ahead of us as we continue to build and improve the lives of people living in our area.
All right, Dr. Becker, we'll be watching the progress. Thanks for being on the show today.
Thank you, Kylie. Have a great